Another person making a difference in this world. Hi, I'm Lisa Caprelli, and today we're talking to one of my favorite people, my daughter-in-law, Lori Vasquez. Lori, what ages do you get to work with?
Treat patients across the lifespan of all ages from 0 to 100 years of age, doing, medication management, psychotherapy, and just, helping to promote their overall mental wellness.
I invited Lori to talk about SEL, which stands for Social Emotional Learning. So, first of all, Lori, how does early exposure to SEL, Social Emotional Learning, impact a child's long term emotional and social development?
So, early exposure to social emotional learning is so crucial to a child's long-term development. I see there's adult patients that from not reaching certain developmental milestones early on in life or learning these skills, they have personality disorders or disorders that are a lot harder to treat later in life. So the developmental milestones in the early years, about 0 to 8 years of age, they can help children to build empathy, to build relationships with peers through emotion regulation, and help them with the academic success as well as reach those milestones during the formative years. It can also help children that are genetically at a higher risk for mental illness. Maybe their parents have personality disorders or just different type of mental illness that are common, anxiety, depression, and having children be exposed to social emotional learning in both the classroom and at home early on, that can really help them to prevent from developing mental illness. So it's very important.
We all know the world changed, especially in the mental health since COVID. What are some of the studies or some of the things you have seen that has changed with those, feelings and emotions?
Yeah, so there's been a lot of interesting studies that more have come out now, like the meta-analysis ones, since some time has passed since COVID. But we've seen an increase in anxiety and maybe some social anxiety and just general anxiety with children, which also comes along with depression. And that can really affect their ability to socialize in group settings. That can really lead to more isolation, which has been the effects of COVID. The isolation has increased anxiety, depression. So that has caused there to be a greater awareness of social emotional learning from the pandemic. So, for example, we have some parents that will come to us with school age children, like about 10 years old. They struggle with anger outbursts, managing their emotions at school or at home. Sometimes it's just one or the other once they get home, or it can be both. And so incorporating social emotional learning into their treatment plans, we do see a significant improvement in their mental health. They are able to control their emotions, be better connected to others, more capable of making positive decisions, especially as they get older into their adolescence, in their teen years. We're worried about substance use and conduct disorder. So the social emotional learning into their treatment plans really do improve their quality of life and help them develop a toolkit of strategies to maintain their mental well-being in the long term.
I mean, it just goes to show you that the early years, the formidable years, they're so, so important. I'm sure you can see that looking back at your life and the people you work with. Explain to some of us that may not be aware of, or maybe our kids are grown now. We forgot what those formidable years were and how they impact.
Early childhood, like birth to age 2, that's when the child begins to, and that's when we begin to develop attachment and trust, language development, and any type of, trauma that the child may experience during those years, depending on if they're switching caregivers, their main caregiver, maybe they're not always there, or they are, but they're just not able to build that bond that can affect, their trust later on in life and have an impact on it. And then there's the toddler years, ages 2 to 3, where they begin to gain their independence. Of course, we call them like the terrible twos. They, want to gain their autonomy, make choices, And they also began to express their emotions during that time. But of course, it's a lot different. That's why we do role playing therapy with children these ages. They can't really sit and just hold conversations, but they do more interacting through toys and such. And it really all does depend on their developmental level. We have preschool years, ages 3 to 5, where they begin to get, more of a sense of their personal identity. They get more into the creativeness, the creative projects, and understanding a little bit more about the right and wrong. And then it goes into the school age years, the elementary years, ages 6 to 8. And that's when they get a little more into the academics, the reading, writing, peer relationships, conflict resolutions. And that really has an impact on shaping their self-esteem. And Eric Erickson is one of the psychologists and psychoanalysts that I really enjoy his philosophy on the developmental years, trust versus mistrust, birth to 18 months, and then the autonomy. And he created different stages for these developmental years to identify with if the child is accomplishing these developmental milestones or not. And he really goes over what the impacts could be if these milestones are reached as opposed to if they're not. And so that's something that if you look Erickson's theory up, you can kind of read about the importance of supportive environments and positive experiences and how they can impact children during these formative years. Now, with all of these studies coming out from since COVID, a lot of meta-analysis are being done, and they are showing, positive outcomes with even the social emotional learning being incorporated into some of the classrooms. So as those studies continue and we continue to see those positive outcomes from the modeling of SEL into the classrooms, I think more school systems will adopt this model, and it will definitely make a long-term impact on children's behaviors, their symptoms of anxiety and depression, and we can hopefully get a better measure on these outcomes.